Welcome back to Pleasure Principles, your go-to channel for sex education and sexual health empowerment. Today's topic is all about recognizing when it's time to seek professional advice for your sexual health. Just like you wouldn't hesitate to see a doctor for a persistent cough, you shouldn't shy away from seeking help for your sexual health. Let's dive into the top 10 signs that it might be time to see a sexual health professional. These are your cues, your body's way of saying, "Hey, let's get this checked out." If you experience persistent pain during or after sex, it's not something you should ignore. Pain is always a signal that something isn't right and can often point to an underlying issue. This pain, known as dyspareunia, can stem from infections, endometriosis, pelvic inflammatory disease, or vaginismus. Sometimes it's not even a physical issue. Stress, anxiety, and past trauma can also impact your sexual experience. A sexual health professional can help you find solutions that work for you. Don't suffer in silence. Reach out and get the help you deserve. If you notice any unusual lumps, bumps, sores, or discoloration in your genital area, don't just assume it's nothing. It's always better to err on the side of caution and get it checked out by a professional. These changes could signal issues like STIs, skin conditions, herpes, genital warts, or even skin cancer. Early detection is key when it comes to most of these conditions. Don't be embarrassed or afraid to talk to your doctor. They're there to help you, not judge you. If you're dealing with ongoing itching or burning in your genitals or surrounding areas, this can be a sign that something's off. This discomfort can point to infections like yeast infections or bacterial vaginosis, or irritations from soaps, detergents, or fabrics. If the itching or burning doesn't go away, or if it keeps coming back, make an appointment with your healthcare provider. They can determine the underlying cause and recommend the most effective treatment. Changes in the color, consistency, or smell of vaginal or penile discharge are clear signs that something's up. If you notice a change in the amount, color, or if there's a strong, unpleasant odor, those are red flags. These changes can be symptoms of infections like bacterial vaginosis, or STIs, such as gonorrhea or chlamydia. Don't ignore changes in your discharge. It's your body's way of telling you something's not quite right. Get it checked out sooner rather than later. Spotting or bleeding outside of your regular menstrual cycle, or bleeding after sex, is something to pay attention to. This kind of bleeding could be a sign of infections, hormonal imbalances, or more serious conditions like cervical polyps, fibroids, or even cancer. Early detection is crucial, so talk to your doctor and get the reassurance and care you need. Don't hesitate to seek medical advice if you're experiencing unusual bleeding. It's always better to address these concerns early on. Erectile dysfunction, or ED, is more common than many people realize and often a sign of an underlying health condition. If you're consistently having trouble getting or keeping an erection, it's time to reach out to a healthcare professional. ED can be caused by stress, anxiety, relationship issues, depression, or physical conditions like heart disease, diabetes, or low testosterone. There are effective treatments for ED, ranging from lifestyle changes and therapy to medications and other medical interventions. Don't be ashamed. Seek the support you need. Burning, pain, or discomfort during urination is a common sign of an infection. This could be a urinary tract infection, UTI, or a sexually transmitted infection, STI, like chlamydia, or gonorrhea. These infections cause inflammation and irritation in the urethra, leading to that painful burning sensation. If you're experiencing this, see a healthcare professional for a proper diagnosis and treatment. If you experience a sudden or long-term change in your libido, whether it's a major increase or decrease, that's something to pay attention to. Significant shifts from your baseline can be linked to mental health issues like anxiety, depression, or stress. They can also be related to hormonal imbalances, certain medications, relationship dynamics, or underlying medical conditions. If you notice a significant change in your sex drive, it's worth discussing with a healthcare professional. They can help identify the cause and recommend appropriate solutions. If you've had unprotected sex or sex with a new partner and you're worried about potential STI exposure, you're not alone. Many STIs can be asymptomatic, meaning you might not experience any noticeable symptoms. Regular STI screenings are crucial for knowing your status and protecting your health and the health of your partners. Early detection and treatment are essential. How often should you get tested? It depends on your age, sexual activity, and potential risk factors. When in doubt, consult a healthcare professional for guidance. If you're having trouble reaching orgasm, whether it's a new issue or something ongoing, it's worth discussing with a healthcare professional. Difficulty achieving orgasm can be caused by stress, anxiety, relationship issues, past trauma, or certain medications. Physical factors like hormonal imbalances, nerve damage, and certain medical conditions can also contribute. There are often ways to address these challenges and improve your chances of experiencing orgasm. Seeking help can make a world of difference in your sexual experience. And there you have it, the top 10 signs that it might be time to see a sexual health professional. Your sexual health is just as important as any other aspect of your well-being. If any of these signs resonate with you, don't hesitate to reach out to a sexual health professional. Thank you so much for watching, and as always, stay empowered and take care of your sexual health. Don't forget to like, subscribe, and share this video if you found it helpful.